Hi, I'm Dr. Cameron Keeney with the Center for Sleep Apnea and TMJ. What kind of procedures are available if your jaw locks? So one of the things that we do at my office is what's called an unlocking procedure. So if you looked at any of the videos I posted before about a locking jaw, you may remember this model here. So this model shows the jaw anatomy. So teeth here, jaw joint here, ear canal here. The jaw joint is made up by the union of the lower jaw with the skull, and in between these two bones there's a disc of cartilage. Now sometimes what happens is the disc gets out of place and we can have some popping and clicking as you open and close your mouth. In some cases that will progress to a locked jaw. So what's going on is this disc is so far out of place that now you go to open and that disc stays out of place. In other words, you cannot open and make it pop back into place like you used to. If someone comes into my office and I think that's the case, the first thing we do is refer them out for an MRI. An MRI shows soft tissue, and this disc is soft tissue. And so we're able to know if this is really the true diagnosis for this case. And so if someone has a locked jaw on an MRI, we'll see that, and then we have the patient back in and we can do an unlocking procedure. The purpose of an unlocking procedure is basically to get your jaw back to what it was before it locked. In other words, back to popping and clicking and being able to open properly. So the way we do that is with a simple procedure in office. Basically we take a short-acting dental anesthetic. We use an injection technique just like a dentist would use with the same type of a needle. You're awake for the procedure. It doesn't take that long. Basically what we do is an injection to the jaw joint with that local anesthetic, and the idea there is we're trying to hydraulically push down the condyle or the mandible, the lower jaw. We're trying to push that down so there's room for the disc to slip back into place. And then once that procedure is done, we use a temporary splint that we make here in the office, and that way it helps to hold this in a better position so you don't lock back up once that anesthetic has dispersed. If you'd like to learn more about this, please visit our website, sleepidaho.com, or please call us at 208-376-3600.